Dr. Mama and Dr. Afom, so nice to meet in person finally after 3 years, having a union in Paris. Thank you for making time to sit down with us. I'm Divya, and I would like to introduce everybody to our audience to you. Dr. Mama is the National TB Manager for Lesotho and very instrumental in the new Lesotho TB plan, strategic plan. And Dr. Afom is the Chief Medical Officer for Partners in Health, and he has more than a decade of experience in patient care, national level guidance programs and leadership. So excited to have the conversation today and learn a little bit more from your experience. So Dr. Mama, I understand that when you started, you were actually working in Lesotho with analog scans. And how was your experience working on analog scans with AI? Can you maybe speak about that?
Thank you very much. Actually, yes. Actually, for me, it was a surprise to hear that analog can work with AI.
Right.
But this was unfolded through our support for Partners in Health that this can happen because originally all our X-rays were analogs.
Right.
So I started picking it from there and realized that it was not all lost. When you have analog, we can still strive to implement Qure, and that's how we started. Yeah, we started, yes.
Yeah. And because there are still places in the world which are using analog scans, what would you recommend, or what would your guidance be to them when they are developing their strategy for their region? How do they, maybe start with the digitization process? How did you go about with that whole process in Lesotho?
Okay, I would say that indeed.
Yeah.
The world now demands that we go digital.
Yeah.
But resources, since are not so readily available, they can still strive to start with the analog and get the requisite pieces of equipment that are required.
Right.
While alongside, I would advise that we strive to get bit by bit this digital and minimize all this, because using the analog is a little bit laborious than when you are using digital.
Right.
But they shouldn't get frustrated when they still don't have digital. They can use the same principles that we applied in Lesotho and be good to go and do the business of diagnosing TB using chest X-ray.
Right.
Yes.
Dr. Afom, any thoughts from you on this?
Yeah, so I think when we realized that we had analog X-rays before, and analog you can do only for, it has a lot of things, like you have to use film, and then you can only do maybe five average, less than 5 patients per day, because you have to take to the dry room and take it out, you have dry room. So but with digital X-rays, you can do many X-rays as you want. And then you can use as any other fracture diagnosis and also for the screening. So I think that's what we realized after we shifted from analog to digital X-ray. We are able to screen patients, we are able to diagnose for other conditions as well. So it's really very helpful for multiple purposes you can use for digital X-ray. That's why we changed all our analog X-rays to digital. Yeah.
Fantastic.
Now we have only, I think, 2 analog, but hopefully we'll change them soon, and there is a plan also.
Okay, great. Thank you. And from what I understand in Lesotho, you're also using like a teleradiology or a telemedicine kind of an approach. Is that right? Are you in touch with some global organizations also for consultation?
Yes, and that is also thank you to our implementing partner who now links us remotely, so that these X-rays that are being done, Partners in Health is working very hard to reach areas. Yeah, we don't have luxury of radiologists as well. Therefore, that remote support is the one that is now handy for us as a country, and it timely diagnoses patients, and it reduces that period between diagnosis and treatment initiation. Thus reduce our mortality, because we are faced with very high mortality among TB patients. So that is very, very useful for us, and I think it will be kind of our future for now, while we are still grappling to get this requisite expertise for on-site reading of X-rays.
Understand.
Yes.
And how does it work? If you can maybe explain a little bit.
The X-rays are in those facilities, very far away, and then they are shipped. I don't know the right word to use, but to the cloud, and then that remote person then reads. And there are also experts sitting somewhere supporting partners in health to read and share their views and help us to make diagnosis of patient. Not necessarily about TB, as he has mentioned, but other diseases. So they have that remote support from. It is affiliated to a university there in Harvard. So they have a lot of support, and it benefits all our Lesotho people.
You said not only TB but other disease areas as well. Which kind of disease areas are they looking for then?
You can see an abnormality. Its true entry point is looking for TB, but not all the things that we see on the X-ray are TB. So then we give direction to whatever abnormality that you see, but which cannot be equated to TB. And then they're able to tell us, no, this one is not TB. We think we can refer, could possibly be a cancer. Go and look. Something like that, yeah.
So you're actually transforming it not only from TB to actually almost like lung health.
It is a lung health. It is a health system strengthening component.
Very nice.
Yes, of providing services.
Yeah. Anything from you, Dr. Afom? Do you see other regions also talking about it? Or
yes. It's really what Dr. Mama has mentioned. Our key priority was TB. Because we have a high burden of TB.
Sure, I understand.
But we're able to see so many other conditions like cardiac conditions, silicosis, like cystic lung disease. So different conditions. So we're able to then link with experts.
Understand.
Immediately we have, like what Dr. Mama said, we have specialists. If it is different religion like cystic lung disease, maybe hydrotic cyst, other conditions that outside of TB. And then we're able to refer to the district hospital, we manage them different treatments, we refer them with proved diagnosis. So it's really to add for how TB work. And when the radiographer took the film, it immediately uploaded in less than around 1 or 2 minutes. Under the system. Any person who has a login credential can log in and access the X-ray. And there is feedback section in addition to the score by TB. And the expert can also confirm as additional thing. And the history also there. The patient history and that. And then the frontline healthcare workers, they can get the timely feedback. Before the patient left home. And then if the patient needs referral also, they can print out
and they can send
and then send with the referral system to the hospital. And then the doctor or health professional at this hospital can just receive the diagnosis already there and everything, and then the management can be started there. Something which cannot happen at the health center.
At the health center. Are you sharing some of your experiences in the conference? Are other regions looking to replicate such a model?
Yes, I think this is shared. Even tomorrow there will be a symposium to share that. And we have also plans to have our own in-house sharing. Because since the X-rays were not so readily available, some of our people still don't know about these benefits. But we are just starting to scale up now. At least now we have 10 districts in the country, and each district has at least access to one X-ray with the AI, and we have seen the increase in the number of patients that we are diagnosing and other abnormalities, as Dr. Afom has just mentioned. So you said whether it's about lung health. So I just remember that according to WHO, the guidance that they gave us, it's like we have to be very holistic in our approach. That is practical. Be practical about lung issues, so that you don't leave anything out. So this is very instrumental for us to achieving that. Yes.
And if I may, if you could dream, in the future, you have seen the space of TB for very long, and you're seeing the progression towards lung health. From analog to moving towards digital to moving towards lung health, what do you want to see more changing, and where can technology play a role, if you could dream of it?
Technology seems to be taking care of everything.
Right.
So thinking in the context of Lesotho, which is a country that is grappling to end the burden of TB in Lesotho, we think that we are already good with diagnosing, but we need to also track our patients along the cascade.
Right.
I don't know how that, it's really a dream.
Right.
So how do we end up not losing these patients along the cascade,
right,
so that at the end we have good outcomes? I don't even know how we can even do, maybe some form of demand creation. I don't know how technology can assist us to create demand for the services, so that people come and manifest their illnesses in time and they don't have to die. Yes.
Dr. Afom, anything?
So I think with this AI, we have been really struggling in improving TB detection.
Right.
And once we start to implement this, it's a big hope for us to perform better in TB diagnosis and put them on timely on treatment. And with this technology, I think our patients has multiple issues, not necessarily only TB. It can go even to other disease conditions. Like what we discussed earlier, we're able to diagnose different conditions like silicosis. We have so many mining, our patients, they work in the mining sector, and cancer, lung cancer, and other conditions. So this technology AI can help us to diagnose and to find early detection of this case as well, beyond TB. But for TB, now we have been struggling with that. I think we saw a light. A light.
You see the light.
The light. Yeah.
Yes.
Yes. This is a big light. I was even discussing with Dr. Mama. This is a new era for TB that is really promising for us. And then we are committed to push forward until the last minute that helps improve our patients' life, because it's really important. And so many patients are dying because of late diagnosis. And so this is the thing that we are trying to fix.
Thank you so much, Dr. Mama and Dr. Afom. Really appreciate you spending some time with us and speaking to our audience. Thank you.
Thank you very much for the opportunity.
We love it.